Dear friends, greetings of the day. This is Khushi welcoming you on Mera Doctor Show. In the last two episodes, we have learned what is depression, the symptoms of depression, the three categories of symptoms, namely emotional, physical, and appetite. And we've also learned the impacts of depression on one's daily life, the suicide warning signs, who are at risk when depression occurs, and how do we diagnose the depression and also the causes of depression. And in today's episode, we're going to learn what are the different therapies or habits or medications that we can adapt in order to overcome this disorder called as depression. Antidepressants affect the brain chemicals such as serotonin and norepinephrine. There are many options. Give antidepressants a few weeks of use to take its effect. Good follow-up with your doctor is very important to make a dosage adjustment or also to evaluate their effectiveness. If the first medication does not help, there is a good chance another will. The combination of different therapies along with medication will definitely improve depression levels. And today first we are going to talk about exercises. How does exercise help reduce depression? Research suggests that exercise is a potential weapon against mild to moderate level of depression. When you indulge in physical activities, your brain releases a hormone called as endorphin, and this helps you boost your mood. Regular exercise is also linked to higher self-esteem, increase in your confidence level, better sleep, and less stress, and importantly, more energy. Any type of moderate activities like walking, running, skipping, cycling, yoga, gymming, or even for that matter, simple household works can help you in this regard. Choose something that you enjoy and aim for at least 20 to 30 minutes a day and at least 4 to 5 times a week. How does pets help you in depression? A playful puppy, a curious cat, or a wise-mouthed parrot. These are no substitute for any medication. But researchers say that pets can ease the symptoms of mild to moderate level of depression level in many people. Pets provide unconditional love and they relieve your loneliness and give patients a sense of purpose. Studies have also found pet owners have less trouble in sleeping and better overall health. So you may choose to have a cat or a dog or birds or even a fish in an aquarium along with shrimps and snails. What is the role of social support in depression? Because loneliness goes hand in hand with depression, developing a social support network can be an important part of treatment. This may include joining a support group or finding an online support club or making a genuine effort to meet your friends and family more often. Even joining a book club or a library or taking a classes for any of your choice can help you connect with more people on a regular basis. Let us talk about light therapy or phototherapy. Light therapy has shown promise as an effective treatment not only for seasonal affective disorder, which is also called as SAD, but for some other types of depressions as well. It involves sitting in front of a specially designed light box which provides either a bright or a dim light for a prescribed amount of time each day. Light therapy can be used in conjunction with other treatments. Talk to your doctor about getting a light box and the recommended length of time for its use. Now, let us talk about vagus nerve stimulation therapy. This is also called as VNS. This may help patients with treatment-resistant depression that does not improve with any kind of medication. VNS is like a pacemaker of the brain. The surgically implanted device sends electrical pulses to the brain through vagus nerve, which is located in the neck. These pulses are believed to ease the depression by affecting mood areas in the brain. Now, let us talk about the third therapy for depression. This is called as electroconvulsive therapy or ECT. This is another option for patients with treatment-resistant depression or severe melancholic depression. This treatment uses electric charges to create controlled seizure. During this procedure, patients are not in their conscious. ECT helps about 80 to 90% of patients who receive it, giving them a new hope to those who don't improve with any kind of medications. Now, let us talk about the fourth therapy for depression. This is called as Transcranial Magnetic Stimulation or TMS. A new option for people with stubborn depression is repetitive transcranial magnetic stimulation, and that is also called as RTMS. This treatment aims electromagnetic pulses at the skull. It stimulates a tiny electrical current in a part of the brain linked to depression. RTMS does not cause seizure and appears to have few side effects, but doctors are still fine-tuning this treatment. In the midst of major depression, you may feel hopeless and helpless, but the fact is this condition is highly treatable. More than 80% of the people may get cured either with medication or with the therapies that we discussed today. There are few people who need a combination of both medication and therapy to get cured. Even when these medications and therapies don't help you, there are cutting-edge treatment that can pick up the slack. As I had told you in the beginning, depression is not a weakness and it is not a negative character. It is just a major health problem which can be cured. I trust so far the information given to you is useful. And if you like our videos, like, share, comment and subscribe. We will come back to you with new topics in our next episodes. Until then, tata, bye bye, take care.